So it's a great opportunity for us to draw a portrait, especially structure-wise, to put in place certain structures to facilitate things and to have success and to build on that. So what I'm going to present today are in the context of a project thanks to the help of the Canadian Foundation for Healthcare Improvement, and there's been some partnerships like this in the past, but in the last year there was some work done to structure the way we work with patients, and these are the objectives of the project, is to create infrastructure to support a partnership and formalize the trajectory of information and recruitment and how we integrate the patients. These are things we have to think about in parallel at the same time as we're working with professionals. So the structure of the project, what we've done in a few words here, a few slides rather, what we've done in the last year, we have been able to look at different models. We've worked particularly with the neuroscience mission and the cancer mission, and there's not the same format in both sides, and so both missions had a team to improve quality, integrate patients from the beginning to the end, and in both cases we really tested the involvement of the patients and with a structure for improving quality. And then cancer, there was also patients that were already on the quality improvement committee, and we created a forum for partnership that is a space with a lot of patients and members of different professions to improve and to exchange and to have different ideas to improve programs and services. So this is really experimentation on our part to see what the better way was to improve the patient and how we can improve the integration of patients at different levels and how we can link up these different ideas so that communication will be better and more, and the patients will be more involved, and in cooperation with the users committee that is present in the cancer mission locally. And so one of the first things that allows us to structure the project is the trajectory of recruitment and training. And it's important, we're going to talk about what happens when if a team wants to collaborate with patients, what really happens on the ground concretely. And the first step is the identification of the patient and first contact. Please slow down. I've been told to speak slower. I seem to be going quite quickly. So the first step is the recruitment and training, is the identification and first contact, and then we ask for cooperation of care teams. You are the professionals on the ground who are most able to identify the patients who will have some of the skills and qualities we are looking for. So I have to mention that we've really worked closely with the team, Paul and Vincent's team, to really work on this recruitment and training. The qualities we're looking for, they're there. That's what we are looking for in patients. As you can see, we're looking for collaborative skills, communication skills, and we see patients that really want to collaborate and work in cooperation with the professionals and improve things, and we want to continue this idea of identifying potential quality candidates and to really have this reflex as a professional to think about recruiting patients and counselor patients and resource patients. So the second step is a telephone and in-person interview. We're going to do this in tandem, in groups, one patient and one professional that work together. That is what we've put in place, and so it's really enriching to have patients and professionals, two different perspectives around evaluating if the profile of the patient corresponds to the project. And as you can see, it's a message to the patients. It gives us a message that you're really serious. The patients have told us that I really felt like I was into a serious process and a very formal interview, and so it really encourages that the patients take it seriously and stay involved. The third part is a preparatory meeting with the patients for certain projects in particular. The idea is we can't take patients and just throw them into a team without having some background work to explain the history of the project, the team composition, sign a confidentiality agreement, obviously because people will be there as full members of the team, so we want to be able to share freely and not worry about confidentiality, and where we can talk about administrative issues as well. So that's a very important part, so that the patients can cooperate fully and feel comfortable in sharing information. And the next step is training. And so in our trajectory, we have multi-level training in our experience here. The experiment we've done is to show, we've shown that the training of facilitators, and so people who will be the facilitators who will guide meetings, they have to have a very specific and a very important training in how to facilitate the integration of patients, speak with the patient to represent their point of view, and so for teams and patients, we've tried different things, and what seems the most relevant and more efficient is a more concrete approach in terms of concepts, everybody, and in terms of what who's on the team, and if people have to buy into the partnership. And so very concrete examples. What does it mean when we say work in partnership with a patient? So we'll see. I'm going to show you some golden rules on how we do things, and it's a way of saying concretely what the partnership means. These are the rules. Can we agree on these rules and live by them? And so really also give them examples of situations and have discussions on what partnership really means. It's a very concrete approach. And coaching also. So we've seen with Pascal before that they're coaching patients, and so we play this role, myself and my colleagues here, so to have a systematic follow-up and to have some coaching and have the opportunity, if there's a need to consult with somebody, ask questions, and there's a structure as well to accompany the patients and members of the team as well if there are issues. So we put this in place, this follow-up process. And so I give you an example of rules of engagement that we've put together through our experiences, and so these are the rules, very concrete ones that really favorize partnership, using first names. There's no doctor, there's no Mr. or Mrs. Everybody is equal. There's a voting system for decision making, so encouraging everybody to participate and put their hands up and vote. That helps the patients that might feel ashamed or not ashamed but hesitate and not sure, and so they're really that might be shy, and so these are things that we want to put in place so that we don't forget the patients. Sometimes when we send an email, it's easy to say we won't include the patients, we don't want to overburden them, but no, we have to include them in every communication and every step. So we have these rules in place from the outset, and it really makes things much smoother, the relationships between patients and professionals, and the patients can always ask for information. If there are things they don't understand, they can ask for the professional, and so these are the things we've developed. And what I want to say as well, the second part of the presentation, this is the structure of an integrated approach, the benefits of the integrated approach, and what we've talked about the last years is the benefits of this approach in improving quality and partnership with patients. So through the project with the foundation, you've seen a lot of integration of patients in the quality committees and projects for improved quality, and that really showed us the added value of at once combining both in an integrated approach. So as it says here, it facilitates participation of patients. I talked about the rules of engagement, but just the fact that it is structured, the patient says, well, I have my documents, I know where we are, I know what to do, a formal structure that allows the patients to more easily follow the project, including creation of collaborative links with all participants. We create objectives together. There's a common vision that is developed, and it really helps to develop a team spirit and to have cooperative links, and so the patients can really feel like they're part of the whole process. Achievement of success with positive impacts for all. So it's very important to start with projects that will give us little victories and to build on those victories, to really start with something concrete, something that we can accomplish, and to get tangible results, and then build on these successes to promote this and to encourage people to participate. And it's a way of integrating the partnership of patients, and it really seems to work well. We have some good success in the MS clinic, and so to involve patients and to encourage people to work this way. And so other groups look at us and say, well, they've done it and I want to do the same thing. So they're really concrete benefits, and this is one of the testimonies of one of the persons that has participated. And
so the structured approach gives us a focus that we don't have. We deal with things piecemeal. This way, we sit together and we solve the problem together. My final point is the added value of using this in a transverse way with a quality structure by accompanying people in the mission. This is not something that's imposed on all the teams from above, but you go out and you say, okay, what do you want to do as projects? How can we support you in the partnerships that you would like to do? So that's the approach that we want to use by going out and talking to people and determining how we can support them. So just a final quote to show that what we're doing, the reason why we are putting these structures in place is that patients feel there's a space for them. They want to be involved, and we create spaces and structures that enable them to do so and to have a positive experience. Thank you.